that introduction. Yeah, thank you for having me today. Some fantastic talks already that I've really enjoyed. But on a slightly different topic, as said, I'm going to be discussing a number of studies that I've been conducting over the past 4 or 5 years, looking at family support for young trans and gender diverse people. I have got two screens going and my slides are on the other screen, so if it looks like I keep looking away, I'm not, I'm just looking at my slides. Um, so, so we know during adolescence and young adulthood, support from parents, carers is really important for all young people. There are often a lot of developmental but normative life changes that happen, and family can be really important in supporting young people navigating through these. However, we know that some young people don't have very good parental or carer support, and this can lead to implications for mental health and well-being when trying to navigate these normative life transitions. And sometimes, unfortunately, what we see is that young trans and gender diverse people don't get the support that they need from their family, so from their parents, from their carers, from their siblings. And that can be problematic because, of course, they've got to navigate these normative life transitions, but on top of that, they're often dealing with their gender identity, grappling with it, coming to terms with it, exploring it, and potentially wanting to navigate some form of healthcare to support them in their gender identity. Now, when we look at the literature around barriers, the majority of this literature is quantitative. So it's often in the form of surveys and has been from the parents' perspective. And so a range of different barriers to providing support by parents or carers have been cited. So sometimes parents just feel that their beliefs, often they will hold essentialist beliefs, don't align with their child's gender identity, and therefore they find it very difficult to support them. They might feel quite emotional about their young person's transition, and that might be because they're grieving part of, I suppose, their family and what they anticipated family to look like in the future. For example, grandchildren, they might feel that that wouldn't be possible if their child transitioned. But also over safety concerns as well. And we've already kind of touched on misinformation that is out there around trans lives in the public domain. And often this can, I suppose, fuel these concerns about what it might be like to be trans in today's society, which of course can be very, very challenging at times. Perceiving a lack of social support, so not necessarily knowing other families that have children that are trans or gender diverse or even part of the LGBTQ plus community, and therefore feeling very isolated and alienated in wanting to support their young person. And of course, a lack of general knowledge about gender identity and what the kind of transition process might look like and so on and so forth, and therefore feeling unequipped to support their young person. Now, when we look at the literature in relation to young people and what they've said about parental support, this again tends to be quantitative. So again, survey-based research. And actually what this research tells us is that when young people do perceive their parents, carers, families to be supportive, that they're more likely to live in their affirmed gender, so live authentically. They're more likely to report fewer mental health symptoms, reduce suicidality, and also engage in more help seeking, so get support for their poor mental health if that is needed. So overall, the message then from the current literature is that actually, when it is available from the young person's perspective, support can be really good for this community. But from a parental perspective, it seems that this type of support might be difficult to come by because parents report so many barriers to being able to appropriately support their young person. So having identified that within the literature, and I suppose that kind of almost conflict between, yes, it's good, but often unavailable or hard to come by, we wanted to delve into this area a little bit more, and have, as I said at the beginning, started to conduct a number of research studies in this area. And specifically, we wanted to understand in more depth how young people perceive family support, how they experience it, to unpack a little bit more, I suppose, conditions in which family support might be protective, but also the inverse of that. So when might family support not be protective and might be detrimental to health and well-being? So the first study that I'm going to talk to you about has been published. We collected this data very early on in the COVID-19 pandemic. So I think it was literally in the May after we'd gone into lockdown. And actually the purpose of this particular study was to generate some evidence base around the challenges that young people were having during this time, and that came through consultation with support organisations that they had recognised that there were a number of challenges, perhaps some that were to be anticipated, others not to. And they wanted an evidence base out there. So we conducted this research just to kind of generally see how young transgendered RS people were getting on during this initial phase of the COVID-19 pandemic. And we had some specific kind of hypotheses about where they might be experiencing challenges. And of course, one of those was around family life. And a prominent finding, unsurprisingly, that came out, and of course is relevant to what I'm talking about today, is around young people, because spending more time often in that family environment. So we had a lot of the participants in this study had moved back from university, for example. So they perhaps were studying, but because of the restrictions had to move back to a family home, or it might have just been the case that actually because of the restrictions, young people, of course, were spending more time in these environments, as were the other people that they were cohabiting with. And this was problematic because often families, unfortunately, were either aware but not supportive of their young person's gender identity, or perhaps they were unaware. So the young person was having to conceal their gender pretty much 100% of the time. And so this obviously had a detrimental effect on young people's mental health and well-being. But within this, we also collected some qualitative responses. So we opened up the survey so people could tell us more in their own words about their experiences. And what was interesting is that they felt that this detrimental effect to their well-being was almost, I suppose, made worse because they couldn't access that positive social support. So perhaps it was at university or at school, college, that they were affirmed in their gender, and this usually was kind of a buffering effect against that negative or support that wasn't available in the family home. So some really interesting and insightful findings from that study. The next study that I want to talk to you about has very recently been published, but we actually started to collect this data, or did collect this data in 2020, but before the COVID-19 pandemic had happened. But again, this was a qualitative study, so it was a survey. We worked in consultation with a support organisation, so Mermaids, that some of you might have heard of, that provides support for young people and their families in England and the UK. And what we found from these survey responses from young people was that it wasn't always the case that family were either supportive or not supportive. It was quite a complex experience with regards to family support, and young people in this study kind of described family support as conflicting, contradictory, or even conditional. So parents may kind of ascribe certain conditions, i.e. once you have reached X age, then you're able to go out there and change your name or access hormones, whatever that may be. And this quote from a young person in the study kind of sums up the complexity of support quite well. So my dad is supportive in that he supports me getting HRT, so hormone treatment, but he has been extremely resistant to getting my name changed, and is by far the slowest person in my life regarding using my new name and pronouns. So again, for this young person, that was very conflicting, confusing. Okay, so you are supportive of me accessing hormone treatment, which arguably is irreversible, but with regards to name, pronouns, are not prepared to be supportive of those. So very confusing. And another kind of key finding that came out of this then was that education or knowledge is really, really important. And young people in this particular study felt that their parents' understanding of gender and gender identity had mostly been informed by misinformation in the media. And sometimes it was felt that these attitudes were quite challenging to address because their parents perceived this knowledge that they'd gained through these sources as superior to actually listening to their young person, listening to their experiences of transition and their gender identity. So again, a quote from a young person in this study. Like my mum, dad had only really heard about trans people in the media, so had lots of preconceived ideas about what a trans person experience might be like. And since I didn't fit his expectation, he was doubtful of my gender identity initially. So this idea of, well, I've learned about trans people and what their lives are like from misinformation, and you don't fit that ideal, and therefore I'm not going to kind of believe your gender identity. So this idea of not being validated by family because of the lack of, I suppose, credible information. So the final study, but slightly larger study that I wanted to talk to you about hasn't been published yet, hopefully will be in the next month or so. But this is a larger study. Again, data was collected during the COVID-19 pandemic, and it's a two-phase study. So we had a quantitative survey part to it, and then in-depth interviews as well to help us understand some of those survey responses. And primarily what we were really interested in here is kind of that aim that I mentioned at the start. So when might or under what conditions might family be protective, but also then the inverse of that. So when might family not be protective? And of course that can be quite useful from a family therapy perspective, because of course then we can design initiatives, interventions to support family supporting their young person. So we kind of based the hypotheses for this study off the social identity approach to health, which is a particular theory within social psychology. And what this kind of led us to predict, if you like, is that the stronger we feel a sense of belonging with our family, that this is going to be protective of our mental health and well-being. But it's only protective because it provides us with a sense of social support and alleviates feelings of loneliness. So normalizes experiences, it alleviates that feeling of alienation, if you like, and that's what's protective. And that's exactly what we did find within this sample. So it supported that hypothesis that yes, feeling a sense of belonging to family can be protective, and it's protective because it provides that level of social support that is needed, and that alleviates these feelings of loneliness. But again, of course, this was telling us that yes, family can be protective, but we know from previous studies that this type of support can be really hard to come by. So with qualitative interviews with young trans people, 20 people, we wanted to unpack that nuance a little bit more so we could understand why we're seeing in the literature that these relationships are protective, but we also know that they are very hard to come by for this community. So we generated 4 themes from this qualitative analysis for those that are interested. We used thematic analysis by Brown and Clark. In the interest of time, I'm not going to go over all of these themes, sub-themes, but I'm going to talk about the ones that I think are kind of most prominent in the analysis. So the first theme, I Can't Be Me When I'm Around You, is about being able to live authentically in gender identity around family. And unfortunately, we found at least around half of the young people in this sample were unable to live authentically with their family. So their family were unaware of their gender identity. And this is not a new finding in the literature. We tend to find that when people are concerned about reactions from others, negative reactions from others, they will conceal their gender identity because this is kind of protective, or any minority identity. But what this kind of study added here is that for young people, it wasn't only about protecting their own well-being, but also protecting family relationships. And sometimes that was on a very practical level. So a lot of young people in this study would talk about how they were still living at home, or they were financially dependent on family, and therefore they needed to maintain that relationship until a time in which they could become financially independent, or for emotional reasons. So some people actually, despite feeling that their family wouldn't be supportive of their gender identity, felt it to be really important to protect those relationships. And I suppose, given the time in which we collected this data, so these interviews were conducted about a year after the COVID-19 pandemic, but of course that was a very stressful time, a time in which we've seen a lot of young trans people were residing with family. So that might have been a real source of social support, if you like, at that time, and they didn't want to damage that in any way. Now, we did have a nearly equal amount of young people in the study that they were able to be open with their family, or at least partially open with their family about their gender identity. So in the family home, they were, or they perceived that they could live in their authentic gender. And you might think, oh, well, this isn't an ideal situation. Of course, that's going to be good for the young person. But actually, we found something slightly different in this study, that there were costs to it. So although family might be aware and might, I suppose, on the surface of it, display that they are supportive, often because they deviated from family norms around gender identity, that meant that they were considered, if you like, the black sheep of the family. They were pushed to one side, and as Kai says here, had psychological implications of isolation and loneliness, which were really difficult for these young people to deal with. Now, as I kind of said at the beginning, for a number of different reasons, family support was considered to be important, even if family were perhaps not entirely supportive, or were not aware of gender identity. They wanted to maintain family bonds to some degree. And so they talked about strategies, if you like, that they felt helped increase the family support that they were receiving. And one of those was this acceptance of imperfect support. So acknowledging that, sometimes parents may get things wrong. It's a journey that they're on. And over time, in most cases, support should improve. And again, Jet here alludes to the complexity of family support. So it's not necessarily black and white that parents are or aren't supportive, but they might be supportive in some aspects and not others. And it's about accepting that imperfect support. And what was clear through these accounts is that, again, it wasn't necessarily perceived to be malicious or intentional. Young people were quite, in most cases, prepared to acknowledge that it was a learning process. And because this data was collected, as I say, about a year after the initiation of the COVID-19 pandemic, some of the young people spoke about how actually being socially isolated with their family had improved relationships and family bonds. And again, this was quite a unique finding, because up until this point, the majority of research that we'd done as well had indicated that that increased amount of time is going to be detrimental for health and well-being because they're spending more time in unsupportive environments. But Joe, amongst a handful of other participants, spoke about how actually, because of the COVID-19 pandemic, because of the stress that was associated with this time, it was a very unique, stressful situation in which a lot of people really struggled to cope. That enhanced family bonds to get through that stressful time. Of course, they were spending more time at home. And here Joe reflects on how that bettered their relationship, and therefore their family better understood their gender identity, and they felt that they could go to them for support when needed. Finally, then, I wanted to talk to you about this last theme that was identified, which in a nutshell is about family of choice. So some of you might have heard of this kind of concept or terminology before, but basically this is family that doesn't contain biological members of family, but may include very close friends that often have similar experiences. So in the context of this study, we found that family of choice often included other trans people who were navigating similar challenges. And this we named it the final part of the jigsaw, the missing part of the jigsaw, because regardless of what type of support young people were perceiving from their biolegal family, even if at least on the surface it appeared to be supportive, as we saw in one of the previous extracts, that level of felt understanding wasn't always there around gender. So yes, we're supportive of you, but actually you're the black sheep, you're deviating from these norms, and we don't really understand your experience entirely because we haven't been through something similar. But family of choice were able to fulfill that need, if you like. So they were able, because of the similar experience, relate to that, normalise it, and people as a result in this study described feeling less lonely, that their experiences were normalised, which sometimes was the first time that they'd felt like that. So what this tells us is that often in regard to family, people have quite a wide definition of family, and may also have multiple groups, if you like, that are considered to be family, and they are needed to complete their support needs and ensure that their mental health and well-being is well supported. So I realised that I've covered quite a lot of ground there in a relatively short space of time. As I say, the first two papers that I discussed are published, so you're welcome to, of course, go and read those in more depth. And the final one hopefully will be published very, very soon. So obviously I'm happy to share that with people if they're interested. Just drop me an email. But in sum, what we know is that family support can be psychologically protective, which is of course important in light of the amount of poor mental health and well-being we see in this community. But consistent and affirmative support is often hard to come by. So we saw within a number of these studies that support can often be contradictory, and that can be quite difficult for young people to manage. But when it is available, we know that family support is protective because it increases perceptions of social support and alleviates loneliness. And withholding social support can leave young trans people feeling like they are the black sheep. They feel misunderstood. They can feel very isolated, which again has a detrimental effect on their mental health and well-being. However, we saw then in that latter study that support needs can be met by a family of choice. So other transgender diverse people, for example, that are navigating similar challenges can be really useful. And when parents demonstrate a readiness to, I suppose, educate themselves and engage in knowledge, it can be really powerful and can even change attitudes that previously perhaps were felt to be unchangeable. But so long as this kind of source of information is coming from credible sources, so we need to encourage parents, or anyone for that matter, to move away from educating themselves via mass media and information that's pushed out via those outlets. So that's everything for me. I'm not sure if we have got time for questions, but I'm more than happy to take them, or you can drop me an email, or I can follow up in the chat.
I can see the claps coming in there, Beth. Thank you so much. My take-home message, I'm trying to get a take-home message amongst the many, was about families of choice. Having published a lot in the literature, the North American literature, the American literature in particular, talks about young people when they disclose their identity being excluded, marginalized, ejected from the family home. So I think families of choice can be really, really important if your birth family perhaps is at a different part in that continuum. I mean, never get to that point of acceptance. So I just kind of think that's my little take home bit amongst many of them there, that we find families of choice that are supportive of us. So can I just check and see how are we doing for time? I'm a rubbish chair. No, no, we are absolutely dead on time. Are you happy, Beth, if people pop into the chat, or if you pop your email address into
absolutely.
the chat? And
that's
the
fine.
references of the two papers that you mentioned, I know you said that you've got one in press or nearly ready, will be of interest to people. One of the things that we found from the research study, one of the studies that we did, was really how families, NGO organisations already have a wealth of knowledge, skills and experience. So schools of nursing and midwifery have got allies there that want to come in and help in the delivery of education programs. So I think many of your points were very well made there. So a huge thank you for taking the time.
Thanks very much.
To come and join us. We're really, really grateful. So we will move on. If anybody, if Beth pops her email address in, the references, if she has them handy, and any little questions there, pops them in. So now we are going to move on to my friend